Hey everybody, happy Saturday. I'm not going to be on here that long. I actually have a spa appointment, so I'm going to go get my nails redone and my feet. So I'm not going to be here on that long, but I kind of wanted to. I haven't done a chronicle in a few weeks, so I am yesterday made 6 weeks post op. Thank the Lord. So that's a milestone. They have all these different milestones they set for you. So my first week, you do a 1 week post-op appointment. Then the next one's a 6 week. So even though my 6 weeks hit yesterday, my appointment with my doctor for my quote unquote 6 weeks is not until June 1st. So by then I'll be, I think, like 7.5 weeks, almost 8. And like I had asked him about that. I went in there on Monday because they removed all my tape. So I got to tell you guys about that. But when I went in, my nurse Molly, shout out to Molly, it's my girl right there. Like, she is awesome. Everyone there is awesome. Everyone. Shout out to Jess, both of the Lindsays, Miss Renee, Dr. Pyle, of course, my favorite plastic surgeon. But anyways, so they were saying that it's fine as long as you hit that mark anytime after that. Not too long after, but within a few weeks it's fine. So anyways, so hit the 6 weeks, and so I'm going the right direction. So really quick, I think I had mentioned to everyone that I had a situation, or maybe I didn't. Maybe the last time I talked to y'all, that hadn't happened. So I had a setback with my belly button. That's my fault. That has nothing to do with the process. Has nothing to do with anything. Doctor, nothing. I had purchased these belly shapers. You know me. I'm like super dramatic, super over the top, right? So I had like purchased all this stuff before I had surgery because I wanted to be prepared. Like, who doesn't want to be prepared? So as part of one of the bundles that I purchased from Shape Curvy, shout out to Shape Curvy, my girl Denise, she owns it. She's out of Massachusetts. She has everything you need for this kind of surgery. Matter of fact, what I have on came from her. I've like gotten so much smaller since last time I did my video. But anyways, so I purchased that from her. It was part of a bundle. And there's two different types. So I purchased both. I didn't know which one I would need. And my belly button was healing perfectly fine. And really, in all honesty, I didn't even need the shaper. But, everyone, I see all these different, like pictures of everybody and their belly buttons. Some of them are like, yikes. But because of how my belly button was before I had surgery, I had an innie, right? So my belly button was kind of like off in the cut. And so it was kind of hidden. So when they do the surgery, they literally cut a hole over your belly button and pull the skin down. So really, my belly button has never been pronounced or out. It's always been in, kind of, inside and kind of hidden. No matter how small I am, like, that's just the aesthetic of my belly button, I guess. But anyway, so I thought, well, I'm gonna start using this. Bad mistake. So suggestion: if you don't need it, don't use it. Even if you bought it, that's fine. Just, if your belly button is healing, let it go. So that set me back a couple of weeks. So I had went in to get that checked, and they told me what to do. So now my belly button it's pretty much healed now. So I'm fine there. But then last weekend, after I had hit 5 weeks post-op, my tape off of my left breast, the bottom piece of the tape started coming off. So I was like, okay, because I told y'all I wasn't going to touch my tape. Like, the tape had to stay on my breast and on my tummy tuck incision for 6 weeks. That's what Dr. Powell recommends. And so I follow directions. And I've found over the years with the different surgeries that I've gone through, no matter what kind I go through, as long as I follow direction, I mean, obviously I'm trusting the doctor, right? But I wouldn't have gone to them in the first place if I didn't. So as long as I follow their direction and I do what I'm supposed to do, I'm going to be fine. And that's never made me go the wrong direction. I've always healed. My doctors have all told me that I heal pretty quickly and pretty well. And with my skin, I don't keloid or anything like that. So it works out pretty well for me. But still, because I'm pretty healthy for the most part. And, I take vitamins. I eat right for the most part. Well, now even more so. Drink lots of water. But still, you just never know. So anyways, I had told them, I was going in and having them change out the tape. I went in like 2 to 3 times already since I've had surgery because I just didn't feel comfortable removing the tape. And so what she said was, don't remove it. If once it starts to fall off by itself, organically, then you can come in and we'll, change it out. So I've been going in, neither one of us, whatever nurse I had, neither one of us noticed it. And all of a sudden, last weekend, the tape at the bottom of my left breast had come off. So I was like, okay, cool. I'll just, I can remove it because it wasn't attached to my skin anymore. It was attached to other tape. So I could just take that off and then put fresh. Honey, let me tell you, I went to do that and I pulled back and I noticed that there was like a hole at the bottom, which is at the bottom of the incision in my crease of my breast. And you know me, I'm so dramatic. I don't want to say a drama queen because I'm not a drama queen, but I can be dramatic at times about certain things. Honey, I was like, what? Like I took pictures, sent an email to the clinical team. They're on call on the weekends. Sent an email to the clinical team, sent pictures, 3 pictures. And I was like, what in the hell? Like I was going off because I had done everything my doctor told me to do. They had been changing out the tape. No one said anything if they noticed it, but I don't think they wouldn't have said anything. They would have told me because they know. And so they were like, don't panic. Miss Renee emailed me. She was like, she's the clinical director. She was like, Renda, don't panic. I was like, I need to be in there Monday because that was like Friday evening. No, Saturday morning. And I was like, no, it had to be Friday evening because I had taken a shower that night. Friday evening. And I was like, I need to be in there Monday. We need to have this, So she was like, I know that they tell you to take, what's it called? I always pronounce it wrong. Brassiterin or something like that. It's like one of the ingredients that's used in Neosporin, but they don't want you to use Neosporin. And anyways, they had me use it for my belly button when that situation had my belly button, but it broke me out and it's like these red little bumps around my whole belly button. So I stopped that instantly and then just started using my liquid dial and washing it in the shower and it cleared up and my belly button healed. So I can't use that. I can't use the Neosporin per their recommendation. So I was like, what am I supposed to use? She said, just keep cleaning it with the dial, keeping it, pat it dry, and then come in on Monday. So went on Monday. My girl Molly, once again, shout out to my girl Molly, the Renda Whisperer. It's several of them that'll like get me off the ledge. Molly, Allison, and Jess. And Jess is not a nurse. She's a clinical coordinator, but that's my girl. Anyways, but Molly was like looking at it. She was like, she's like, yep. She's like, I know the other ointments, bothered you. The one ointment bothered you and, we don't want you using Neosporin. Just keep washing it. She was like, so it's called Telfa. So I tried to use Band-Aid on my belly button and because of the swelling that's still there, it left an imprint. So on my skin. So they were like, use Telfa and Telfa, you can buy it at, any drugstore, Walmart, anything in the pharmacy department. And, it's non-adhesive, but it still stays on your skin. And so I bought that and that's what I've been using. I use it on my belly button and it worked. It didn't irritate me. And so I use it on my breast, the bottom of my breast. So it pretty much, the whole, she said it'll heal from the inside out. And, but there was also like a little piece underneath it of like a tiny bit of, it almost looked like fluid had been there. But it looks like loose skin now, just a little bit, not like hanging skin, but it's like if you press it, it's soft, but it's a little bit of a pucker. It's a little loose skin. And so she was like, Renda, worst case scenario, she said, this should heal. That loose skin should go away once this opening heals. She said that it's basically at the very bottom, because I had a lollipop incision. There's multiple types. So basically what they do is they go around your areola, and then he does a cut down there. So my areolas, now that my tape have all been removed from all my incisions, I was able to see them. Oh my God, they look beautiful. Like my doctor, Dr. Powell, I love you, Dr. Powell. He is awesome. Anyway, so the only thing that was jacked up, and I say that respectfully, was the very end of where the lollipop incision was at the very end, going into the crease of the breast. And so that, I guess that is kind of complicated. So it turned out when she took the tape off of the other one on my right breast, that one had the same situation, but it had already healed. So we didn't know about it. And there was no loose skin. So I'm like, okay. So it just happens that I happen to catch this one. So anyways, she said worst case scenario, let's say that little loose skin, a little tiny, and it's not that much. It's very tiny amount right underneath where the suture was open. If it doesn't heal, she's like, I can, if it doesn't tighten up after, the area is completely healed, I can go into the office, they can numb me, and Dr. Powell can just sew it up and tighten it up. So I was like, okay, that was good to know. Cause I was like, so she was like, no worries. I was like, okay. So, she took the tape off my incision, my tummy tuck incision, and it looked really good. It does. It's still healing, obviously, but it is closed up. I don't see any dog ears. Dog ears, by the way, is at the very ends of the incision where they start to poke out of your hips or that area. It doesn't happen all the time, but it's a percentage of people that get those. And that's something that can be a revision as well. But I don't have those. I didn't keloid on any of my breasts, my tummy. None of it is very, very smooth. And so now it's just a matter of like lightening up. They give you this scar salve. It's actually made by one of the ladies that works there at Amelia Aesthetics. She's also a patient at Amelia Aesthetics. Anyways, she made it. And so it's something they give out to all the patients once they hit 6 weeks post-op. So now that although Monday I wasn't exactly 6 weeks. I hit 6 weeks yesterday. She said it was fine. So everything looks pretty good. It's just, I still have the swelling. Now, like I said, you can see me. This is my stage 2 faja, which basically means girdle in Spanish. And I buy this from my girl, Denise. Like I said, it's shaped curvy. Shout out to Denise. And so it's different than the first one I had. The first one covered the breasts and everything. It was a full compression. This one covers everything except the breast. So now, because now I can wear, at 6 weeks, you can start wearing bras with wires, but because I'm still healing, I'm not 100% healed with that open suture, I don't feel comfortable. And Molly agreed, like, don't wear any wire bras until you're 100% healed on your breast. So I'm still wearing my sports bras, and then the bras, these specialty bras that I purchased from Amazon, which are fire. They're fire, as my swarty sister says. And so they just, your breasts look so pretty in them. So, but right now I'm just wearing a regular Guess sports bra that I wear when I work out. So I put that on, and my breasts, they still look really good. They are sitting up, even though they fluffed up and settled. They're still at attention. They look really, really good. So I just wanted to follow up. I need to get off of here to go to this appointment, but I just wanted to follow up to let you all know how I was doing. Other than that setback with my belly button, which is now cleared, and the setback with my breast, which is clearing up, everything is going well. The swelling, that's what I was going to say. The swelling, it's off and on. I woke up like 2 weeks ago and I was flat as a board. No lie. Like out of nowhere. My stomach had been swollen for weeks, and then I just woke up, it was just my belly just completely, not completely, but like a little bit of swelling around the belly button, because that's really where I have the swelling, is the belly button. But the area above my incision, all that, like everything was like flat as a board. I took pictures immediately because, they call it swell hell, because you swell. It's a roller coaster. Like one day you'll wake up, you're perfectly fine. You wake up another day and it's swollen. You look like you're 6 months pregnant. You know what I mean? But I haven't been that bad since I first had surgery. When I first had surgery, I was flat, and then I swole up. And for 9 days, I was swollen, but that's because I couldn't have a bowel movement. I had a bowel movement day 9, and I told you I've been shitting ever since. And my stomach hasn't been that swollen. I look like I was about 4 or 5 months pregnant, but that's over with. I haven't had that since. Right now, it's just this mid part. I'm swollen right now. I don't have any lipofoam on or anything. This is naturally me, but it's swollen right here. I can't even feel that. There's no sensation there yet. It's still numb. But actually, let me stand up. So, I mean, it looks really good. I look really snatched, obviously, but I mean, it's just the swelling is like so. It's constant. It's constant swelling. It really is. So, I don't have any complaints though. Like, I'm blessed. I've had a really, really good, good recovery. I do think, and I told Dr. Powell this when I went in about the belly button, that, because I ended up seeing him as well while I was there, because he heard I was panicking, so he came in. He's also a render whisperer as well, him and Molly. But I told him, I was like, Doc, because there's only so much lipo they can do when you're having this kind of procedure, because there's guidelines they have to follow. So there's only a percentage of fat that they can take out. And so at the end of the day, I'm not 100%, I still feel like there's some more fat that needs to go. I knew that I didn't know, but I had a feeling that like not all the fat. I mean, he had told me that, sorry y'all, that, he didn't specifically say like, hey, you're not going to be flat. I am flat, but right in the middle area where the belly button is, that's where it's kind of like puckered a little bit on the left side. The right side is flatter, but it's like a strip. And to me, it looks like fat. And it's just a little strip and it's kind of puckered. And when you try to smooth it out, it just won't smooth no matter what. It has gotten flatter than it was. So let me not say that. It has gotten flatter, but it's just not 100% where it needs to be. The area where my incision, all that's flat. This part that I'm talking about is on the left side of the belly button, and it's just a strip going down. And then on the side of it, I'm like all sucked in, like so it looks a little odd to me. I don't want to say deformed, but it just doesn't look as good as I want it to look. So I have to give it 3 months before we decide on, if I need to have like a revision or anything. So I'm not going to sweat that. It is what it is. If I have to have it, he'll just go in and do more lipo, but I don't have to have any more tummy tucks or none of that foolishness. It'll just be revising the area, because he couldn't take all the fat out. It's just not possible. I mean, he did lipo all the way around the bra line. He did lipo around the stomach area, the flanks and all of that, so it's just really difficult. So this time around, it will be a revision, and I won't be paying for it. And he'll just be going in and just fixing it up. And then, like I said, getting this little area under the breast, that little loose skin. That's something like they said they can do in the office. But like if I wait till that surgery, they can do it all at one time while I'm under. That's it. I think some doctors do let you do revisions awake where they just deaden it, but I'm not that patient. So Dr. Powell probably don't want to do that with me. It will not work out. I just don't have a good threshold for pain. I think I've gotten better with all these procedures I've had, but it's still not there. I'm still not that patient. Anyways, so everything is going well. Okay, so, I lost 25 pounds before surgery. I've lost 10 pounds since surgery, and I've got 5 more to go. Once I do that, I will have lost 40 pounds, and I am donezo. It's just about maintaining my weight. But all is well, no worries. Okay, you guys, I'm about to roll out, get dressed, and roll out to my appointment. Just wanted to follow up and let you all know how I'm doing. Everything is going well. My mouth, oral surgery is my results for my mouth are going well. I don't have my rubber bands in. I'm going to put them in a second. Excuse me, but that's going well. They looked at it, and my dentist, I had my cleaning, 6-month cleaning. He did an x-ray. He said it looks pretty good, and I've got an appointment next week with my orthodontist to tighten it up, and they're going to be removing it's this bottom tooth is ready to it's out, so that's good. We're just waiting on the top one. So everything is going well. I'm going to be getting vaccinated next month. I'm excited about that. So everybody, please get vaccinated if you feel comfortable. We definitely want everybody to stay safe and be well, you and your families. Anyways, all right, everybody, don't, dislike, subscribe, pass the word on. Thank you for watching my channel. I appreciate you taking the time. And like I said, well wishes to you and your family. Stay safe, and I'll talk to you soon. Bye.